So at this time, I would like to introduce Jasmine Guanlao to present the lab standardization project.
Thank you. So as Ryan mentioned, my name is Jasmine, and I am an instructor with the Practical Nurse program, and I'm very proud to present our lab standardization project. The duration of our project was July 2012 to July 2013, and we are currently in the improved phase. We were very lucky to have a project team of course specialists who devoted their entire summer term to this project. Currently, with fall term classes starting, the yellow belts continue to work for 4 hours per week. So our work description is to reduce the defects per unit of our non-consumable and consumable equipment, which is clearly defined in our project problem statement and objective. So the definition of a defect for our project is excess inventory, broken equipment, missing equipment, lack of equipment, and misused equipment. To give you guys some context, if each individual in this room was enrolled into a practical nurse lab as a student, every second one of you would have a defective piece of equipment to learn with. So not only did we realize that equipment defects was an issue in our program, so was the amount of non-value-added work our staff was doing to set up the labs. This spaghetti diagram depicts the movement required to set up one skill for spring 2012. We start off on the second floor of HEC 106, move downstairs, then divide up into the 3 labs we work in. If we can't find our equipment in the lab, we check the other 2 labs. If it's not in the other 2 labs, we check the various supply closets that we have. Once we gather the equipment, we can then run the labs in HEC 106. But we run labs in HEC 102. Once we've gathered the equipment from HEC 106, we then either need to transport it ourselves or ask for the EDON to move it for us, which results us in putting in a work request. Once the request is processed, the equipment is transferred between buildings across a very busy and dangerous street to the other building in HEC 102, where it is then picked up and dropped off into the labs. But if it is not in the lab that we need, we then move it to the lab we need. And just to make sure we have everything, we check all the storage rooms to make sure there's nothing missing. Being good nurses that we are, we always return things back to where we got them. Each lab skill setup for spring term required 6 instructors and 2 EDON staff, a total of 12.75 man-hours, which is a total cost of over $27,000. So, how did we solve this? 5S, set in order, sort, set in order, shine, standardize, and sustain. We started off with sorting. Using the double classroom in HEC 106, we inventoried over 350 different types of equipment from all 6 PN labs. You guys can see there are these random bed sheets covering. That was actually put there by our staff because after inventorying for over 3 weeks, it got overwhelming to look at, so they visually had to cover it to maintain some sanity. This is our halfway point. At this point, 2/3 of our equipment has actually been removed, but as you can see, there's still a lot of work to be done. And this is actually what that classroom is supposed to look like once we actually put all of the equipment back into its proper location. After the inventory, we realized another issue. We need tighter equipment control. We estimate that in skeletons alone, we've lost over $35,000. One of the many 5S solutions that we implemented was to set an order. So our gloves before were set in a very difficult to reach and dangerous location. That shelf is actually over 8 feet high, and I'm only 5'2". The gloves after are now located in easy to reach and safe location, with the most frequently used gloves within reach and the least frequently used gloves set out of the way. Another 5S solution we used was standardization. All of the practical nurse labs are now set up to be identical, with everything clearly labeled and contents identified. Some of the highlights of our operational benefits is an increase in staff morale and cohesiveness. We've also been able to build relationships between the Practical Nurse Program, various Norquest programs, and other nonprofit organizations through donation and collaboration. Our key results achieved. As of September 4th, 2012, our DPU for non-consumable equipment has been reduced to our goal of 0 defects per unit. Because of this, we have also been able to significantly reduce our waste of motion. As of fall 2012, this is currently what our lab setup looks like, with each lab skill setup requiring only 6 instructors working a total of 2 man-hours, for a yearly savings of over $23,000. But what does this mean to our customers, the students? Reducing costs is always positive, but we cannot lose sight of the Practical Nurse Program's original goal, to create quality healthcare workers. Healthcare workers that one day will be taking care of you. That's what it's supposed to look like when I do it right. It's actually nerve-wracking to inject on a person. I need to practice more. I'm sure you're all very happy that our students have the appropriate equipment to practice on. And I'm also sure that you are all aware of how vital safe handling of biohazard materials and basic hand washing is to prevent the spread of infection. We are now able to ingrain these behaviors into our students, who will be future nurses, at the grassroots level to ensure that when they get out and take care of you, they will stop the infection in its tracks. This is so much more realistic. Now I know why hand washing and cleaning is so important. So what did we learn? We learned how important equipment is to student learning. We learned how easy it is to decrease silos when you become open to collaboration. We learned how processes are essential to efficiency, and how important it is to not only standardize our equipment, but our delivery of education to ensure consistent knowledge bases. It is our goal for October 2012 to implement various processes to maintain and handle equipment, educate staff, and audit our equipment to sustain what we have achieved. Both staff and students have given positive feedback regarding the Practical Nurse Lab Standardization project. Our future is looking very bright.